How to treat an infant cold. Use a combination of saline drops and suction to remove excess mucus. Tip your infant's head back and squeeze drops of an over-the-counter saline solution into their nostrils. Read the instructions to see how many drops you should use based on your baby's age and weight. Saline drops will help thin out the mucus and make it easier to remove. Have your baby lay flat on their back for 2 to 3 minutes. Then use a rubber bulb to suck out the loose mucus. Boil the bulb for 3 to 5 minutes before you use it to clean and sterilize it. Allow it to cool completely before using it on your child. Before using suction, squeeze the bulb to release any air. Gently insert the tip of the syringe into your baby's nose. Only place the syringe inside the nose 1/4 to 1/2 inch, 0.64 to 1.27 centimeters. Angle the tip towards the back and side of the nose. Squeeze to suck up the mucus, then gently remove the syringe from the baby's nostril. The best times to do this are before feeding your baby or putting them to bed. Apply petroleum jelly to your baby's nose to treat irritation. Rub a thin coating of petroleum jelly on the outside of your baby's nose to reduce irritation, focusing on areas that look red, chapped, or sore. Avoid using any medicated nasal sprays on your baby because this can make the congestion worse. Mentholated topical ointments and rubs are not recommended for children under the age of 2. If your baby is truly struggling with congestion, talk to your doctor during your visit about non-medicated rubs formulated particularly for infants. Run a humidifier to help your baby breathe better. A humidifier or cool mist vaporizer sends moisture out into the room, which can reduce your baby's nasal inflammation and relieve stuffiness. Placing a humidifier in your sick infant's room may make it easier for him or her to fall asleep. Make sure that you change the water each day and clean the machine as directed by the manufacturer. You can also run the hot water in your bathroom and sit in the steamy room with your baby for 15 minutes at a time if you do not have a humidifier. Keeping your child comfortable. Make sure your baby gets plenty of rest to help them recover. The human body uses a lot of energy in fighting off infection. Keep your baby out of stressful situations and encourage calm forms of play, such as listening to stories or playing peekaboo, instead of physically demanding active play. Allow them to nap and sleep as needed, understanding that they may be more tired than they are on a normal day. You can give your baby toys that will occupy them but keep them calm. Try reading to them or offering them their favorite stuffed animal. You could also sing or play music for them. Give your baby fluids such as water and juice to keep them hydrated. Drinking fluids prevents dehydration and thins out nasal secretions. You don't have to give your baby any extra fluids, but you should make sure that they continue ingesting the same amount of fluids as usual. For babies 6 months or older, try plain water, fruit juices, ice pops, or an electrolyte solution such as Pedialyte or Onfalid. For children less than 6 months, breast milk is best, but you can also give them water. Breast milk provides immune-boosting properties that can help protect your baby from germs. If your baby won't take fluids, contact your doctor. Offer your infant warm liquids to help aches and congestion. If they are 6 months or older, your infant can have chicken soup or warm juice like apple juice. Warm clear liquids can relieve sore throats, congestion, aches, and fatigue. Make sure the liquids are not hot, but warm. They should not scald or hurt your baby. Try testing the temperature on your wrist using the same technique that you use with a bottle. Using medicine to treat the cold. Seek immediate medical attention if your baby has a fever. If your baby has a temperature over 100 F, 38 C, they need immediate medical attention. A fever could be a sign that something else is wrong. Call your doctor if your baby has irregular symptoms or is under 3 months old. Contact your doctor if your baby is irritable, has any eye discharge, has difficulty breathing, or has a chronic cough. These symptoms need medical help to clear up. Additionally, if your baby is under 3 months, contact your doctor as soon as you notice cold-like symptoms. For newborns, colds can turn into serious illnesses. If your baby has any symptoms that worry you, contact your doctor immediately. It's better to get your baby checked out than not. Use fever-reducing over-the-counter medication. Acetaminophen is safe for children 3 months and up, and ibuprofen is safe for kids 6 months and up. Look for over-the-counter medication that can be given in small doses and carefully obey the instructions. These medications often come in children's formulas that are safe for infants. If you have any questions about the dose your infant can receive, contact your doctor prior to administering it. Check with your doctor to see what dosages you should use. Avoid these medications if your child is dehydrated or vomiting, as it could make the condition worse. Avoid giving your infant over-the-counter cough and cold medicine. These medications may ease symptoms, but they can cause side effects. If your child has any discomfort or pain because of their symptoms, contact your doctor. They may be able to provide a prescription medication or an appropriate pain management plan. The FDA strongly advises against over-the-counter cold medicine for children younger than 2 years old, and many manufacturers have stopped making these products for children under the age of 4.